Hi guys, welcome back for our daily practice questions. It is day 70, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. And real quick reminder, you guys, y'all know my FMP and AGMP 5-week review is up and coming starting on April 21st, and it runs through May 30th. If you are looking to join, I have 3 more available slots. Do not miss out on your road to success for boards. I would love to have you guys. We work through in small increments of all of the content, including the non-clinical content, to prepare you for boards. We break it down into small increments, covering a little bit each day with videos, assignments, a downloadable workbook. And we also meet weekly as a group to do live practice questions. And if you're unavailable during the time that we agree upon as a group, the replay is always available for you to watch, and you have continuous access even after the course is completed. We work through all of this for that 5-week period, and then I do an additional week so that y'all are able to sign up for individualized sessions to work with me so we can talk through your progress through the 5 weeks, see where you are. I evaluate your post-test scores and give you advice on next steps so you can continue to prepare or go ahead and test. Like my review course that we did from January 13th through February the 14th. That following week after our individualized session, one of the students went ahead and took boards and passed. So if you're end of graduation, if you're struggling with getting your studies structured, if you feel overwhelmed, if you feel like it's so much and you need to really get it down into more bite-sized increments so that you can consume and retain it so that you can effectively apply it, then this is the course for you. But if you have any questions, let me know as well. 3 spaces are remaining, so if you're looking to join, click the link in the description, okay? All right, let's get into our questions for today. Question number 1 states, a 28-year-old patient undergoes hepatitis B serology testing with the following results. The HBsAg is negative, the anti-HBs is positive, the anti-HBc is negative. What is the most likely interpretation of these results? Is it A, acute hepatitis B infection, B, chronic hepatitis B infection, C, a Hep B immunization, or D, immunity due to prior hepatitis B infection? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely interpretation of these results? All right, so we're talking a Hep B serology panel, right? And our HBsAg is negative, so that means they do not have the infection, right? Because the surface antigen lets us know if they actively have the infection. So it's negative, so they do not. The anti-HBs is positive, so we know they have antibodies, right? Either from like a vaccination or they've had prior exposure to the infection, right? They've had the infection in the past, right? That's the way you would have antibodies. And then the anti-HBc is negative. So if that's negative, those core, they think C at the end, anti-HBc is your core, so your IgM, your IgG, letting you know either acute or chronic. This lets you know that the person has the infection or has had exposure to the infection. This is negative, so this just lets you know that this patient has most likely been vaccinated because the antibodies are the only thing that are positive. So C is your best answer. They had the Hep B immunization, okay? All right, question number 2. A 40-year-old male patient hepatitis B serology results are as follows. The HBsAg is positive. The anti-HBs is negative. The anti-HBC IgM is positive. And the anti-HBC IgG is positive. What is the most likely diagnosis? Is it A, chronic hepatitis B? Is it B, acute hepatitis B? Is it C, previous hepatitis B exposure with immunity? Or D, recent Hep B vaccination? Take a moment and tell me what you got in the comments, y'all. All right, you guys, so stem the question here. What is the most likely diagnosis? Your best answer here is B, acute hepatitis B infection. Now, I know you're probably like, Brittany, what in the world is this? And I did this on purpose just to kind of show you some variability. This probably will not be something that you will commonly see on boards, but I'm also that person that likes to kind of throw in things here or there, just in the event that you see something a little bit different so you can understand the why, okay? So again, the HBsAg is positive. So that, like I told you, the surface antigen lets us know if they actively have the infection or not. So it's positive, so they got the infection, right? Anti-HBs is negative, so we don't have our antibodies. Anti-HBC is positive, your core. Typically, you're going to see one or the other. The IgM is going to be positive or the IgG is going to be positive, right? IgM being acute, IgG being chronic, right? But sometimes early on, the IgG will be positive in the acute phase because there is or has been prior exposure and there is exposure and it can run on as well. But that IgM is letting you know that it's acute. That anti-HBs being negative is letting you know it's still acute because they don't have any type of immunity or anything as you would anticipate if this was something long-standing or if they were immunized, right? So the best answer here is acute. You still may be looking like, girl, what? But just process through this. And again, on boards, you most likely are going to get like the straightforward one, but just in the event that you get something like this, I wanted you to understand how to approach it. So the surface antigen is positive. We have the infection. They don't have any antibodies, but remember that early on, if you see both, it's more than likely acute, especially if they don't have any antibodies, you want to think acute because the IgG can sometimes be positive early on in that acute phase from prior exposure. Okay? So acute hepatitis B. B is your best answer. And question number 3. A 55-year-old patient presents with hepatitis B serology results. The HBsAg is positive. The anti-HBs is negative. The anti-HBC Ig is positive. And the HBeAg is negative. What is the most likely diagnosis? Is it A, chronic hepatitis B with low viral replication? B, acute hep B infection? C, hepatitis B immunity from prior exposure? Or D, previous hepatitis B infection with viral clearance? Take a moment and tell me what you got, you guys. All right. So similar question here states, what is the most likely diagnosis? All right. So what are we diagnosing? We're looking at this hep B serology, right? The HBsAg is positive, so we know they have the infection, right? That surface antigen is positive. The anti-HBs is negative. The anti-HBC Ig is positive, so we're thinking chronic, right? G is gone, is chronic, right? And the HBeAg is negative. Now, y'all know I tell y'all to focus on the main things, right? So I tell y'all to focus on the surface antigen, the anti-HBs. This will let you know if they have the infection or if they have immunity, right? Then we start to look at those core, the IgM and the IgG, to see if it's acute or chronic. So we've done that. Now let's talk about this because I get a lot of questions from you guys on these. So I wanted to throw one in so you can kind of get a understanding on how to navigate that, right? With the HBeAg. This is talking about viral replication, right? So the best answer here, number 1, is A, chronic hep B, right? We all agree on that, right? And the HBeAg being negative lets us know there's a low viral replication. So what does that mean? If there's a low viral replication, they're either like on an antiviral or something, or the body is effectively fighting off this infection. So the virus replication, it continue to increase or expand, so to speak, is low, which is a good thing, right? That's what you want it to be. So that HBeAg being negative shows us that it's low. Okay, so your answer again is A, is chronic hepatitis B with low viral replication. Typically, we see this more so when you're trying to figure out on management and treatment of this in practice. So oftentimes you don't see stuff like this on boards because what they're trying to see on boards is that you know how to identify, assess, diagnose, and treat those things that are more commonly identified in practice, right? And so that's why I tell y'all, don't get so hung up of going down the rabbit hole of all the alphabet soup. Pay attention to the main things. But I threw this in so that I think it gives you more confidence when approaching this, and it puts you at ease when you're able to just have a little bit more clarity on the outlier. So I wanted to throw it in from this standpoint so you can gradually add pieces in to get a better understanding in hopes of allowing you to approach these questions a little bit more confidently, because I think all of the variables with it make y'all so nervous about it when it's really not that hard when you start to see what you should truly pay attention to. So I hope that my method is helping y'all see it. That's the goal. So I'm trying to give it to you in increments to make it a little bit easier to grasp so that you can retain it easier. All right, you guys, I hope you found it helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And of course, if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. But as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.